Sandra.
Hi.
What are some things we can do during our preschool year to get ready for kindergarten?
It is important to make sure your child is up to date on all of their immunizations and to establish a pediatrician for your child. By making sure they get their physical on a yearly basis, children learn the importance of seeing a doctor, and parents can discuss any concerns they may have with the pediatrician. It is also important to have a dental provider and take your child every 6 months to get their dental cleaning so they get used to going to the dentist and learn why it's so important to take care of their teeth. Taking care of your child's overall health is a great way to keep them healthy so they can attend school every day.
Every child starting preschool must have on record their annual physical form. This form is due 30 calendar days after the child's first day in school. It must be a physical within the last 12 months. Upon expiration, we will request a new physical form. The preschool health assessment form can be found on our website. For our funding sources, we are required to include hearing and vision screenings on the physical. If it is not completed by the doctor on the form, we can complete these screenings at school. We have both an autoacoustic emission screener, or OAE, and an audiometer for hearing, and spot screener for vision. Staff will also take heights and weights of children at the beginning and end of the school year for data tracking. Dental health is very important to your long-term overall health. Getting your child in to see a dentist early in life is your first step to helping your child with good, healthy habits. The dental verification form showing your child's dental visit results is due by the 90th day of their enrollment. Everyday health is important to monitor to make sure that your child is healthy enough to go to school. Here you see Nurse Jackie Parker meeting with Aviana, who was brought to the office due to not feeling well. Nurse Parker asks a few questions and takes Aviana's temperature. Sure enough, she has a fever over 100 degrees and needs to go home. So the family is called to come get her. Miss Jordan arrives to pick up Aviana and has to sign off on the child sent home form, agreeing that she understands that she cannot send Aviana back to school until she is fever-free for 24 hours without the help of medication. Speaking of medication, we know it's hard to change your schedule to keep your child home, but please do not give your child medication and send them to school. Medication effects wear off within a few hours, and your child will be back to feeling miserable and be spreading their sickness to other children. Here is an overview of Pender County Schools' communicable disease letter to families that goes over the times you should keep your child at home. This information is also in our handbook. If your child has any health conditions such as asthma or allergies or needs medication at school, please let Sandra Sarmiento, our Health and Family Services Coordinator, know so she can contact your child's school nurse and make sure all of the paperwork is completed to allow your child to start school. All forms needed for medicine at school are available on the Pender County Schools website and through our office. If a child needs medication at school, it must be brought to the nurse by an adult at the school to be checked in by the school nurse. Your child may need a medical action plan for the classroom, so please be sure to notify us of any health conditions your child may have. The school nurse will determine if we need this plan for the classroom. Now let's talk about nutrition and our school meals. In public schools, no matter what grade your child is in, every family should go online to apply for free or reduced meals. Families only have to apply once for all children in the family. The meals application can be completed at www.family.titank12.com. This also helps the school system to be eligible for additional funding. As reviewed earlier, we eat meals at school throughout our school day. If your family chooses to send your child's meals from home, the family will have to sign off on the nutrition opt-out agreement. This agreement is required by child care and states that you as the parent will do your best to provide USDA nutritious meals, and that if you do not provide all the required items, the program is not liable to provide it for you. Please note that the school cannot provide refrigeration for meals brought from home, and staff cannot microwave meals for children. If you do send meals with your child, please do so on a consistent schedule. Some children eat the school breakfast every day and bring their lunch from home every day. Others bring meals Monday through Thursday and have school meals on Friday. It's up to you on the schedule, but please be consistent to help our teachers. If families forget to send their child's meals, they will be provided school meals, and any fees incurred will be the responsibility of the family to pay. Finally, let's review pottying. If your child is not completely potty trained, listen up. Families must work toward having their child fully potty trained in order to maintain a preschool classroom status. You see, preschool classrooms are not required to be equipped for children in diapers or pull-ups. If a child is not fully potty trained when they begin school, the families must meet every other week with the family advocate and teacher to discuss what strategies are being used at home and at school. Toilet trained is defined as no longer requiring the use of diapers, pull-ups, or plastic pants during school hours. For children who are accepted and are not completely toilet trained, a potty training packet will be given to help assist the family in completing this fundamental parenting responsibility. Staff are committed to working with families to make sure that toilet training is carried out in a manner that is consistent with each child's physical and emotional abilities and with the family's concerns.